Remember when the FDA said you should not take ivermectin if you have COVID-19? Well, now, as has become the case commonly, it's backpedaling. The FDA created this webpage in 2021 titled explicitly why you should not use ivermectin to treat or prevent COVID-19. And here's a straight answer from the FDA's website. It plainly says, should I take ivermectin to prevent or treat COVID-19? The FDA answered no. While there are approved uses for ivermectin in people and animals, it is not approved for the prevention or treatment of COVID-19. But the FDA is downplaying its role in the disinformation pushback against ivermectin. The FDA's lawyers are now arguing that it did not flat out tell people to stop taking ivermectin and that instructions to not take ivermectin were simply an informal recommendation, not that serious. This is all part of a lawsuit we've covered here on The Absolute Truth, where 3 doctors allege the FDA interfered with their ability to safely prescribe ivermectin to patients. Let's bring in one of those doctors who have advocated for ivermectin education since the beginning, cardiologist and epidemiologist Dr. Peter McCullough. Welcome back, doctor. You're also the author of Courage to Face COVID-19, Preventing Hospitalization and Death While Battling the Biopharmaceutical Complex. And I think that pretty aptly describes you, because, doctor, you were one of those few people who were willing to speak up. What does this backpedaling from the FDA really mean?
What it really means is that the FDA has committed wrongdoing or malfeasance, and this is now prima facie evidence of it. You know, in 2018, the FDA had a very nice statement on its website saying why doctors should use drugs off their original advertising labels, and the reason is to fulfill an unmet need. And in 2020 and 2021, clearly COVID-19 was an unmet need. There were no approved oral antivirals. We were using hydroxychloroquine and ivermectin according to how we should do it by the FDA guidance. So when the FDA came out and specifically said that doctors should not use ivermectin, and specifically misled the public with a tweet that said that ivermectin is horse paste, and actually said quit using it, the FDA caused harm. Doctors had found ivermectin to be useful in reducing the risks of hospitalization and death, and particularly in a U.S. study by Roster and colleagues called the ICON study done in hospitalized patients, ivermectin was associated with reduced mortality. So the FDA's actions led to unnecessary deaths, and I think justice will have to come. The FDA now should be broadly sued, probably in a class action case against those who lost loved ones pre-hospital and during the hospital.
That's where I was headed next, doctor, because I recall on my timeline, Facebook, even my personal one, I actually went through a couple of nights ago just to look back at some posts I remembered from people I grew up with, people I went to college with, who went into the medical field, worked at hospital systems that based their policies on what the FDA and CDC had to say, and they followed suit for the systems and the clinics they worked in. And I looked at those posts of these people and how influential they are in their local circles, right? Their hometowns. People trust them because they know them, and they were parroting this from the FDA and spreading this misinformation. And then they were working for hospital systems that were saying, no, you can't prescribe this, and then telling their loved ones, oh no, this is bad for you, it could hurt you. And I just have to feel like there has to be some accountability in a large scale way for this.
It's true. When the FDA makes mistakes, they're open for lawsuits. And these types of lawsuits are simply for wrongdoing. The FDA's only role here is to say, stay silent. Doctors were following the guidance on the appropriate clinically indicated off-label use of medicinal products, and the doctors decide the community standard of care. The FDA doesn't have any role or really any expertise in determining what community standards are. Their only concern is drug safety, and there ivermectin is one of the most safest drugs we have, safer than Tylenol in terms of fewest adverse event reports. So here the FDA now is caught being culpable, and I anticipate a flood of lawsuits against the FDA.
Now, I do too, and I think also as it relates to kids down the road, we're probably going to see a flood of lawsuits as they continue to push these vaccines on children. But the encouraging news, doctor, is that parents seem to have a little more discernment when it comes to their children, and there's not really a massive uptake on the vaccines. The Academy of Pediatrics says 90% of toddlers did not receive the mRNA vaccine, and after everything we've seen over the last few years, parents are really questioning not just the mRNA vaccines now, but the entire it's such a lengthy routine childhood vaccine schedule. Mine was 11, I think, at the time that I was a child getting vaccinated. And when I had children and I looked at it, I was overwhelmed at how much it has expanded. So how much do you think this is going to impact parents in skipping the vaccine schedule going forward?
I think parents and doctors now are going to re-examine the whole vaccination schedule because of the COVID-19 vaccine debacle. And people are going to start to ask questions. Do we need to have vaccinations against easily treatable conditions like pertussis and diphtheria and tetanus, which are covered with standard antibiotics? Do we need to have vaccines, for instance, for influenza in children, where the influenza vaccine last year had statistically insignificant effect from zero? It basically had zero effect last year. Should we expose children to any type of immunologic stimulus for something that has essentially zero efficacy? And then lastly, I think there'll be a critical evaluation of this broad blanket use as opposed to targeted use. There are groups that clearly could benefit from hepatitis B, meningitis vaccines, but again, they should be targeted at specific ages and not broadly applied. There's great concern that there's too much front loading, that the infant is managing way too many injections early on. The immune system could be damaged or misdirected.
Yeah, I can't even tell you how shocked we were within the first 24 hours alive when they came to get our first child to take them for a hepatitis B vaccine. And my husband was a little bit taken aback and said, well, I don't understand that. And so we did a lot of research after that. But before we run out of time, there was the news last week out of the G20 that they are going to push forward with endorsing the World Health Organization's global vaccine passports. Your general reaction to that news?
You know, to base a passport on essentially an ineffective vaccine and a vaccine that's is racking up terrible safety profiles, still under emergency use, is completely misguided. The G20 should be focusing on worldwide inflation, disparity, world conflict. They shouldn't have any role in trying to opine on emergency vaccines and passports related to them. They're assuming that the vaccines stop the infection, block transmission, or reduce hospitalization and death, and they do none of them. And our agencies agree they do none of them. So at this point in time, they should drop the vaccine passport idea completely, and I think the whole world would be greatly relieved.
I agree. Dr. Peter McCullough, thank you so much for joining us. Your court case is one of those out there right now that is very important to the general public, and we will be keeping an eye on it and keeping our viewers posted as developments come along in your case. And we'll remind our viewers that your book is available at couragetofacecovid.com. Good as always to see you, doctor.
Thank you.